Hey guys, so today we'll learn about malaria and the life cycle of malarial parasite, along with the classification of anti-malarial drugs and their mechanism of action. So, malaria is an acute infectious disease. It is one of the most widespread disease caused by protozoal parasite of genus Plasmodium. The parasite is Plasmodium species. There are four variety of species of this Plasmodium: P. falciparum, P. vivax, P. malariae, and P. ovale. Malaria is transmitted by the female Anopheles mosquito and is characterized by high fever with rigor, anemia, etc. Now let's see in detail the life cycle of the malarial parasite. These parasites spend a sexual phase in man and sexual phase in female Anopheles mosquito. You'll see what I'm talking about when we go into the details. The infection develops in the liver, okay? Then it invades the RBC. There they grow, and these RBCs burst every 48 to 72 hours. As a result of this, fever, chills, and swelling occurs at the time of burst. When a female Anopheles mosquito bites a human being, the sporozoids from the salivary gland of the mosquito enters the human blood. When the mosquito infects the host, sporozoids enter human blood, which mature into schizogony in the liver, in the hepatocytes. Hepatocytes rupture and release merozoites, which are another form of the parasite. Merozoites are then released from the hepatocytes. These merozoites then invade the RBC and causes rupture of RBC. And from the RBC, we can have a sexual cycle where more merozoids, it can undergo a sexual cycle where more merozoids are released from the RBC. So these merozoites initiate a sexual multiplication there. And it can also have sexual cycle where the male and female gametocytes are formed. And these are taken up by the mosquitoes. And it gets into the gut of mosquitoes where the male and female gamete form a zygote, which in turn forms oocyte, and which forms the sporozoite, which is ready to infect a new host when the mosquito bites the person. So this has been the life cycle of the malarial parasite, how malaria is transmitted from person to person. We've already seen what is malaria and the life cycle of malarial parasite. Now let's study the classification. 4 aminoquinolines: chloroquine, hydroxychloroquine, amodiaquine, pyronaridine. 8 aminoquinolines: primaquine, tafenoquine, bulaquine. Synchronous alkaloids: quinine, quinidine. Quinoline methanol, mefloquine. Biguanides, proguanyl, chlorproguanyl. So these are like the chemical classification. First, let's see 4 aminoquinolines. That comes chloroquine. Chloroquine is very effective against P. vivax, P. ovale, P. malaria. It is primary drug in the treatment and prevention of malaria since 1940. How does a malarial parasite survive in the host RBC? Hemoglobin upon digestion yields amino acid that are utilized by parasites for its survival. And the other byproduct of hemoglobin is heme, which is a toxic compound. Presence of free heme is fatal to the parasite. Hence, the free heme undergoes polymerization in the presence of heme polymerized to form hemozoin, which is a non-toxic compound. So now the survival of the parasite is very easy since there is no toxic compound which poses its risk to survival. Now let's see the mechanism of action of chloroquine. How does it work as an anti-malarial agent? So chloroquine first enters the RBC, then it enters the acidic food vacuole of parasite. Thereupon, chloroquine inhibits heme polymerase enzyme. As you know, heme polymerase is involved in the conversion of heme, which is a toxic compound, to hemozoin, which is a non-toxic compound. So there is accumulation of toxic heme then. The parasite membrane lysis occurs. As a result, there is death of parasite. Okay, so that is basically the mechanism of action of chloroquine. Now, the uses of chloroquine or its antimalarial action. It is a highly effective blood schizonticide. It completely eradicates hepatic amoebiasis, which is a liver infection caused by amoeba. It is a first-line agent against PY-VAX. Now let's see the pharmacokinetics of chloroquine. It is commonly administered by oral route, but it can also be given by IM and slow IV routes, metabolized in liver and slowly excreted in urine. Now the adverse effects are nausea, vomiting, skin rashes, diarrhea, blurred vision, etc. Upon parenteral administration, it could cause hypotension, confusion, cardiac arrhythmias, convulsions. Next class of antimalarial drug is ataminoquinolines, in that primaquine. It is least toxic and more effective. Moving on to the mechanism of action, it is effective against pre-erythrocytic and sexual forms of all malarial parasites. Primaquine generate reactive oxygen species that destruct cellular component of parasite. The pharmacokinetics of primaquine, they have rapid and complete absorption upon oral administration. Primaquine undergoes hepatic metabolism and urinary excretion. The following are the adverse effects. There may be epigastric distress, hemolytic anemia, weakness, abdominal pain, etc. The uses of primaquine are: it is a radical cure of P. vivax and P. ovale malaria. It has gametocidal effects. Now moving on to the next class of drugs, it is biguanides. In that we're going to learn proguanil. Proguanil is most widely used antimalarial agent. It is converted to active cycloguanil in vivo, which is a triazine derivative. This inhibits dihydrofolate reductase enzyme or DHFRase. This in turn interferes with nucleic acid synthesis of parasite, which in turn causes the death of the parasite. Proguanil also inhibits gametocytes. Now the antimalarial action. Schizons of both P. vivax and P. falciparum are sensitive to proguanil, but is slower in action when compared to 4-aminoquinolines. Now, there are some side effects to this drug, which are hematuria or blood in urine, rashes, stomatitis. The pharmacokinetics of proguanil. There is rapid and complete absorption from small intestine upon oral administration. It is partly metabolized and excreted in urine. Now, the next class of antimalarial drugs is Synchronous Alkaloids, in that we're going to discuss quinine. It is the oldest and widely used antimalarial agent. Let's discuss the mechanism of action of quinine. It interferes with cellular oxidation of glucose and depresses the action of several enzymes. Quinine is a schizonticidal drug and is mainly used for suppressing symptoms like pyrexia, rigors. So it is a suppressive prophylactic agent, that is prevention of the disease. Now the following are the adverse effects, which include epigastric pain and synchronism, What is synchronism? We're going to discuss that right now. A large single dose or higher therapeutic doses of quinine taken for a few days produce a syndrome called synchronism. It consists of ringing in ears, nausea, vomiting, headache, mental confusion, vertigo, difficulty in hearing, visual defects, diarrhea, flushing, etc. This happens due to direct neurotoxicity as well as constriction of retinal and auditory vessels. Now, the pharmacokinetics of quinine, they're rapidly and completely absorbed orally. Quinine is 70% bound to plasma proteins. Quinine is metabolized in the liver by CYP3A4 and excreted in the urine. It has a T half of 10 to 12 hours. Now let's discuss what is black water fever. It is also known as malarial hemoglobinuria, less common yet most dangerous complication of malaria. It occurs due to infection from parasite Plasmodium falciparum. It is associated with high mortality, that means higher number of deaths. Symptoms of black water fever include rapid pulse, high fever and chills, extreme prostration or weakness, psychological or physical weakness, rapidly developing anemia due to low number of RBCs. Urine color may be black or dark red. And the reason for this is the presence of large amounts of hemoglobin released during extensive destruction of patients' RBCs by malarial parasites. Now, here we reach the end of the discussion of antimalarial agents. Hopefully, this video was helpful to you in some way. Thanks for watching.